We're here to talk about motions to avoid after having an anterior total hip replacement. In this scenario, there's a few very specific motions that we want to avoid after surgery. The first motion we want you to avoid is bringing your hip backwards too far behind your midline. You can walk normally, but try to avoid excessive hip extension coming backwards. Other motions we want you to avoid are having that hip turn outward. So, in this scenario, we don't want to cross over our right leg if our right hip was replaced over the left. The surgical leg should never cross over top of the right. Also, when we go to turn, we want to make sure that we're keeping our nose over our toes in standing. So when we go to turn, our nose and our toes stay together. To play it safe, if we're always turning towards the surgical leg, we should be fine. Now, when it comes to lying down, you can lie down on your right or your left side. Doesn't matter which side was replaced, but we will ask that you keep a pillow between your legs. So we can put the pillow down before we lie down, lay down into a sideline position, and everything should be nice and fine. And those are the motions we want you to avoid after an anterior hip replacement.